All right. Okay, so for today, ayan, we're going to finish na lang with the remaining topics in parasitology, starting first with the last tapeworms na gyud, your Echinococcus, Tania, multiceps, and also the uncommon human cestodes, and then finally the arthropods, no, of medical importance. Okay, so wait lang, dear, teka lang. Ayan, pasensya, sorry, sorry. May emergency eme. Okay, anyway, ayan. So, we're going to continue na no with the Echinococcus species again, and then Tania crassicep, Tania multiceps, sorry, and then the uncommon human cestodes, and then finally the arthropods of medical importance. All right. So again, if ma-disconnect ko dears or whatever, ma-choppy, then just tell me. All right. So atong last Friday, Thursday, no? Thursday. So ato nang gihuman ako pang mga tapeworm. All right. Ubay-ubay na to sila. And then sige, so kinsa ganito ato ang dog tapeworm, the cucumber tapeworm or double pored tapeworm. Kinsa ganito siya? See?
Di kanino.
Okay. Your Dipylidium caninum. All right. So Dipylidium caninum. All right. Now, kinsa ba to ang dwarf tapeworm? Your
Hymenolepis nana.
Hymenolapis nina. All right. And then your rat tapeworm is finally your
H. diminuta.
okay. Panghina ng boses mo, dear. So, okay. H. diminuta. All right. Hymenolapis diminuta. All right. Very good. Now, for today, we're going to start with the remaining na, and that is your Echinococcus granulosus, no? So, your Echinococcus granulosus, if not, it causes, no, really a deadly and life-threatening disease. No, among the tapeworms, I believe this, the Echinococcus species really cause the deadliest, no? And if life-threatening yun ng mga diseases, all right? So your Echinococcus granulosus was formerly known as your Tania granulosus. It's the shortest, ayan, the shortest among the tapeworms because nara siya tulo ka segments, no? You have immature, mature, and gravid. So meaning, iyahang head, neck, all right? Usa ka immature, usa ka mature, and then usa pud ka gravid. Inanara siya ka tihik, no? Inanara siya ka gamay, no? So short tagid kay siya. One proglottid for each type of proglottid. So again, usa ka mature, usa ka immature, usa ka mature, and then one put ka gravid. So it's very short, no? So it's the shortest among the tapeworms, but it causes one of the life-threatening diseases sa mga tapeworms, no? Your Hydatid disease or your cystic disease. Okay. So again, common name, this is your Hydatid worm. Habitat is small intestine for the final host. For humans, connective tissues, all right, man, kita, which serves as the accidental intermediate host. Now, the true final host are your dogs, no? Canines also, mga coyotes, red fox, dingo, etc. So, mga canines, no? Mga dogs. Intermediate host is your sheep. The main good is sheep. But it can also use your goats, cattle, moose, reindeer, swine, horses, and camels. So, katong mga ungulates, no? Katong mga four-legged or four-footed, no? Four-footed mga animals. Yes, you have. Pero ang pinaka-main good kay sheep. All right? Now, kita, humans, we are accidental lang. Okay? So, accidental intermediate host. Now, infective stage to final host to the dogs is your hydatid cyst. To your intermediate host are your eggs. Okay? Your embryonated eggs. All right. Now, mode of transmission, ingestion of egg. Okay? For humans. Kitag yun. Okay? Ingestion of the egg. And the egg will develop into the hydatid cyst sa sulod nato, all right, in humans. All right. Now, for the adults, as you can see, the adults again are very small and it's the shortest, no? Only a single proglottid at each stage of development, as I've mentioned. So you have the head, all right, the neck, usa ka immature, usa ka mature, and then usa pud ka gravid. So about mga 3 to 5 segments ra ihang worm, no? Adult worm. So, na siya kamaba, no? Jutes. Okay, charot. Ayan, so shortest. Now, the scolex, it is armed, okay? Armed rostellum, all right? With 30 to 36 hooks. The gravid proglottid is the widest and the longest among the three proglottids. And there could be several hundreds of these worms in the intestine of your canine or your final host. Now, take note that kinsa na itong mga armed rostellum, di ba? We have Tania solium, you have H. nana, you have Dipylidium caninum, and then finally you have Echinococcus granulosus. So sila, mga armed rostellum, okay, as I mentioned, dears, may mga question na inana, alright? Which of the following tapeworm has an armed rostellum? Which of the following do not have hooks in their scolex? So please take note of that. No, mas easy na lang ang life if ma-separate na ninyo na siya. Okay, so armed rostellum so far, you have T. solium, you have H. nana, you have Dipylidium caninum, and then you also have Echinococcus granulosus. So you have 4 na. All right, okay. Now that's for the adults. Again, very short, no? One proglottid at each stage of development. All right. Now for the eggs, as you can see, it's embryonated, similar in appearance with your Tania. All right. So it cannot be differentiated from the eggs of Tania. So it contains the oncosphere pa rin, and inside the oncosphere is the hexacanth embryo. Hexacanth meaning 6 kahooklets, diba? So again, same ra siyang eggs, oncosphere from Tania until your Dipylidium so far, diba? So oncosphere, hexacanth, embryo. All right, okay. Now we go now to the life cycle. All right, so for life cycle, first we'll start with the intermediate host, no, which is sheep, pwede pud kita, no? So again, ang infective stage ana is unsa man ang ato ang eggs. Okay, now eggs will be released in the environment. All right. Now, these eggs, once we eat this accidentally, or ang mga sheep manggani, o magkaon sila grass sa soil, no, sa farms, whatever niya na ay tai, okay, that contains the eggs of your Echinococcus. Kita pod accidentally fecal oral or from food ba or water. So these eggs, again, will hatch in the intestine. The oncosphere, ayan, will penetrate the intestinal wall and it will migrate through the circulation to the various organs, especially the liver and the lungs. And inside the liver and the lungs, dito sila mo develop sa larval stage sa imuhang Echinococcus, which is known as your hydatid cyst. Okay? So kita as humans, no, we are dead end, no, dead end intermediate host. Kaya ang makuha nato lang yun is the larval stage. And mo develop siya within our organs. Okay? Sa liver and sa lungs and other organs also. All right? And this larval stage of your Echinococcus granulosus is known as hydatid cysts. Okay? Now, in definitive host, mga dogs, no, let's say na yung mga dogs no na duol og slaughterhouse inana. So nya nag-slaughter sila sheep. All right? Now, kato mga internal organs sa sheep, okay, that contains hydatid cyst, di ba? Kay recall, ang sheep pod kay intermediate host. So therefore, naay hydatid cyst iyahang organs, okay? Now, let's say na nag-slaughter sila sheep, all right? Mga slaughterhouse, ayan. And then katong internal organs sa sheep, let's say ilang ginapakaon sa dogs, ayan. So when the dogs eat the internal organs of sheep that contain hydatid cyst, the hydatid cyst, of course, will burst out, all right? And inside the hydatid cyst are mga protoscolices or mga gagmay na scolex, okay? And paggawas nila dito sa intestine sa dogs, all right, these colex or these colices will then attach to the small intestine of your dog and become adult. And then the life cycle goes on, mupas na po sila egg sa stool, okay? And then the cycle goes on. So therefore, ang eggs makitaan siya sa dogs. Humans kita dili makita ng eggs sa ato ang stool. All right? Because again, we don't have the adult stage of your Echinococcus granulosus. All right? So I hope na gets lang. So kita humans ang atong nakuha kay eggs from the environment, and the eggs will hatch in the intestine, okay, and will become hydatid cysts or larval stages of Echinococcus in the organs in the body, different organs in the body. All right? So muna siya life cycle. Ayan. So again, eggs makuha sa humans, and then these eggs will become hydatid cyst or the larval stages in the different organs of the body. But for dogs, again, pag mukhaon sila og mga viscera, okay, or mga internal organs sa sheep such as liver, mga lungs, whatever, and if these organs contain hydatid cyst, the dogs will then be infected. The dogs will have the adult Echinococcus granulosus in their intestine. Okay, so sila mo produce sa eggs. All right, so that's for the life cycle. All right, so I hope na gets to. So this is the life cycle of Echinococcus granulosus. All right. Now for the hydatid cyst, so somebody ng hydatid cyst, okay? So the hydatid cyst is again the larval stage of your Echinococcus granulosus. Diba? We have defined this sa start pa lang. Diba? We have cysticercus for your Tania, cysticercoid for Hymenolapis, Dipylidium, Raleatina, and then of course the Echinococcus species is your hydatid cyst. Now this hydatid cyst is of course is a cyst structure. It's fluid filled and daghan siya mga sulod, no? So it's very slow growing in humans, all right? And for Echinococcus granulosus, the cyst is known as unilocular, meaning tanang contents, all right, makita na gyud sa usa ka cyst. Okay? So everything, no? Inside the cyst, naara gyud siya sa usa ka cyst. So dili siya mo spread to others. Okay? So so later natin picture sa mga parts. So we have an outer laminated hyaline layer. So this is the covering, and usually gikan na siya sa host, no? Gikan na siya sa host. And then we have an inner nucleated germinal layer. So by the name itself, germinal. So diri manggikan ang mga scolex, mga brood capsules, or mga daughter cysts. Ayan. Now the brood capsules are again gikan sa germinal layer, and inside the brood capsules are protoscolices. So we say protoscolices, katini siya mga ginagmay na scolex pa lang. So gasugod pa lang no na mahimong mature scolex. Now the daughter cysts are really like mga small versions of the entire hydatid cyst. So later natin picture ana, no? So daughter cysts are like the miniature version yun, the smaller version, the smally, the baby version of the entire hydatid cyst. Ang brood capsule naka-attach siya sa imuhang germinal layer. All right? Okay. Now hydatid sand, these are parang collection of the scolex, no, mga protoscolices, mga hooklets, all right, na naa sa sulod na nag-float, all right, sa imuhang hydatid cyst. And your hydatid cyst again is fluid, no? Na siya sulod na fluid, all right. Now in other cases, your hydatids may become sterile kay na bacterial infection. So possible na na-colonize na ang hydatid cyst with bacteria na ngamatay na ang mga scolices. All right? So that's for the components of the hydatid cyst. Sige. So ito lantawon ang picture. So this is the hydatid cyst, all right? Now the outer layer again is known as the laminating membrane, all right? And this comes from the host, all right? So it's a connective tissue. Next you have here the germinal layer. Ayan, nasa inner. So the germinal layer pasabot ana germinal. So kung asa magsugod or asa mo germinate, all right? And these one kani mga nakatapot, ayan, naka-attach sa germinal layer. These are known as the brood capsules, all right? Now, these brood capsules, kaning mga ginagmay dire, these are now the protoscolices or again, mga baby na mga scolices. So, possible na pag mo-mature ni siya or mo-erupt ning cyst, kaning mga protoscolices, mo ni siya mo-attach sa imong host to become adults, okay? Or to create new cysts also, all right? Now, these are again brood capsules. As you can see, naka-attach siya sa germinal layer. Now, the daughter cyst, as you can see, the daughter cyst is a miniature version of the hydatid cyst. So, as you can see, na siya laminar layer, na siya germinal layer, ayan. So, na siya part sa hydatid cyst, but it's the smaller version. Okay, so that's the daughter cyst. Alright, so I hope na gets lang ang difference between the brood capsule and the daughter cyst. Now, again, in the fluid inside, there could be mga detached na protoscolices, mga hooklets, whatever, inana. And that is known as the hydatid sand because iyang appearance murag grains of sand. Okay? So that's for the components of the hydatid cyst. Okay? So I hope na gets lang. You have the brood capsules, you have the daughter cysts, you have hydatid sand. Now, very important because kani siya na cyst, if mo erupt ni siya or mabuslot, kani mga daughter cysts, brood capsules, pwede silang mo create og another hydatid cyst, di ba? Let's say kaning daughter cyst, similar siya appearance sa imuhang hydatid cyst, di ba? So possible gud siya maka-create og new cysts in the surrounding tissue. Let's say if mo erupt ni siya or mabuslot, all right? Now, kaning mga protoscolices diri na naasa hydatid sand or kaning naasa brood capsules, pwede po silang mo-attach na sa intestine, all right, to become adult worms, all right? So, muna siya possible mga consequences if mabuslot or mo-rupture ang hydatid cyst. But you know, that's again, the components, take note, germinal layer, laminating layer, nasa gawas, all right? Then you have the brood capsules, the daughter cysts, and of course, the hydatid sand. All right? Now, another illustration, ayan. As you can see, same ragyapo, no? Hydatid sand, you have the brood capsules and the daughter cyst. So usually ang daughter cyst kay naka-detach siya from the germinal layer. And again, as we have mentioned, the daughter cyst is a miniature, no, smaller, smally baby version sa imong hydatid cyst. So na siya germinal layer, na siya laminating layer, all right? Pero it's a smaller version inside the hydatid cyst. All right? So that's the daughter cyst. Now as you can see, sa sulod there's invaginated ang mga scolex. Para siya gyapon sa imuhang cysticercus. Invaginated siya. Now once na siya sa host, mugawas ang scolex, all right? Evaginate, di ba? And mo-attach na siya sa imuhang intestine. And it becomes adults there and mo-mature na siya, mugama na siya sa proglottids. Okay? But usually again, kani siya na process is seen sa mga dogs. Okay? In humans, usually wala tay adult Echinococcus sa ato ang intestine. All right? Sige. So that's for the hydatid cyst. So I hope na-gets lang to dears. Alright? Na-gets siya ang structure sa mga hydatid cyst. Alright? So do not be confused with the brood capsule, the daughter cyst also, and the hydatid sand. Okay? So it's very important na dili siya mo rupture. Okay? Kay very deadly. No? Pwede siya mo spread. Okay? So that's possibly why it can be deadly also. Alright. Now we go na to the disease, your echinococcosis or hydatid disease. Now, your hydatid disease is again potentially dangerous, pero the symptoms will depend kung asa siya na organ makita. All right. So we'll start first with the liver because the liver is the most commonly affected. All right. So 70% of the cases makita nimong hydatid cyst sa liver. All right. Now, it may cause early symptoms if the liver is in the if mudako siya, no? And then it can produce pressure in the different areas, blood vessels sa imuhang liver. All right. Symptoms can also include pain, hepatomegaly, cholestasis, biliary cirrhosis, portal hypertension, and ascites. No? If not ma-infected ang cyst with bacteria, of course, it can become abscess, magnana. All right? Now, cyst rupture can lead to cholangitis and cholestasis. All right? So, inflammation of the bile duct. All right? And inflammation of the bile duct. So, here's a picture of the liver, sulod, and these are the hydatid cysts. All right? So, dagko siya no, ng mga cysts. But as you can see, individual gyud siya na cysts. Okay? And makitaan gyud nimo na siya outer covering. Okay? So, makitaan gyud nimo siya na, okay, cyst gyud ni siya. No? The structure is clear. Makitaan gyud nimo na siya outer wall. All right? So, that's for Echinococcus granulosus. That's why it's called unilocular. Meaning, the cyst contents are within one cyst na gyud. Na siya covering, intact iyahang covering, intact iyahang structure. All right? Okay, so that's for the liver. Again, liver ang pinaka-common, all right, na affected sa ato ang mga cysts. Okay. All right. Next, you have the lung cysts. Following the liver, ang lung ang next affected. So again, same ra gyapon mga symptoms, no? Respiratory symptoms. If the cysts rupture, no? If mubuslot or mubuto imuhang cysts, expectoration of the hydatid fluid, and also there could be lung abscess and infection. All right. And there could also be pneumothorax, no? And empyema, allergic reactions, and anaphylactic shock. Sputum may also contain frothy blood, mucus, hydatid fluid, and bits of membrane. So because again, the inside of your hydatid cyst, once rupture siya, it could lead to severe allergic reaction sa host. Okay? Pwedeng na ay inflammatory reaction, intense inflammatory and allergic reactions ang body sa sulod, no, against sa contents of the hydatid fluid. So that's why it's very deadly then if mo rupture siya. All right. Now other body sites, pwede siyang maabot po sa spleen and kidneys. All right. Pero di kayo common, less na lang. There could also be sa heart and sa brain, pero mga 1% na lang in the patients. They can also cause severe damage if located siya in a vital area such as a bone, no, sa osseous cysts. So pwede siyang maabot sa bone. And usually if sa bone siya, kay medyo mas intense iyahang complication. All right. Now, involvement in the brain may cause intracranial pressure and Jacksonian epilepsy. So, as mentioned, Jacksonian, di ba? We have mentioned that in Paragonimus, schistosoma also. Na Jacksonian, one part lang of the brain ang na-seizure. All right. So, the patient can still remain conscious. All right. So, Jacksonian epilepsy. Renal involvement, if naabot siya sa kidneys, intermittent pain, hematuria, all right, kidney dysfunction, and hydatid material in urine. So, that's why it can be deadly because pwede siyang spread to a lot of organs. All right? So, possible na if dagan kaayo, pwedeng mabot siya sa liver, napod sa lungs, no? Pwede po sa brain. So, if dagan kaayo eggs imong nakaon, possibly, no? So, ayan, that's why it can be deadly. All right. Now, here's an example of your pulmonary hydatid cyst. As you can see, sa radiograph daw or CT scan na siya water lily na sign. Ayan, so meron siya water lily, no? Ayan, water lily na sign. Next, you have a cranial or cerebral hydatid cyst. So this is the cyst found in the brain, no? So it's really big. Okay, ayan. So that's for the cranial hydatid cyst and pulmonary hydatid cysts. Okay. Now, again, lung, brain, spinal cord, and orbital sa mata, usually seen in younger patients. There have been reports of Hodgkin's lymphoma and your cystic hydatid disease occurring together. Pero the relation between the two is quite rare, ang cancer and also hydatid cyst. Immune reactions, ayan. Now, if chronic ang infection, because the hydatid cysts usually, dugay siya mo-grow as mentioned, di ba? So possible na after pila pa ka years, ma-feel sa patient ang infection or ang symptoms. Or after pila pa ka years, magawas ang symptoms. Now, throughout those years of chronic infection, there could be slow leakage na of fluid inside the hydatid cyst, no? So, pwedeng mo hinay-hinay lang gawas ang fluid. And this fluid will sensitize already the patient, okay? So, wala pa kayo intense na allergic reactions, pero na-sensitize na siya, all right? Now, if it bursts, if the cyst bursts inside, this will now result to a severe anaphylactic response, no? Or allergic reaction. Because again, intense na, no? Na-sensitize naman siya daan. So, pag balik, okay, pag erupt na gyud sa cyst, which contains a large amount na gyud of hydatid fluid, it will then elicit or it will induce an intense allergic reaction or anaphylaxis. Okay? All right. Now, release of cyst tissue may lead to abscess formation, emboli, all right, and the development of additional young cysts at secondary sites. So when we say secondary cysts, again, as I've mentioned, di ba, ang sulod sa hydatid fluid, mga protoscolyces, mga daughter cysts. Now, if pwede na siyang rupture, pwede siyang ma-spread to other organs, okay? Or to the surrounding tissue. And these daughter cysts, brood capsules, hydatid sand, can then create additional cysts, okay? All right. So secondary cysts. And these secondary cysts and infected cysts usually causes higher mortality rates. Okay? All right. Now, multiple cysts on different major organs may consequently result to multi-organ failure. Of course, if daghan ng mga cysts. So, usually, ang secondary cysts daw ang mas deadly. Kaya possibly na nagsugod na siya sa usa ka organ, liver, na ni-rupture siya, so dito siya ni-spread. Okay? So, muna deadly ang secondary cysts. Okay. Now, hydatid cyst fluid is full, no, of your P1 and PK substance. So, sa P blood group, ayan, di ba? And anti-P1 was seen in patients with Echinococcus granulosus na infection. So, therefore, the hydatid cyst fluid can be a source of anti-P1 in neutralizing mga antibodies or ang hydatid cyst fluid can be a source of the P1 substance para ma-neutralize sa mga anti-P1 antibodies, no, sa imuhang mga blood banking whatever. Okay, 'di ba? So neutralization of antibodies sa blood banks, no, sa blood bank, no. So we can use hydatid cyst fluid as a source of P1 substance. Okay? All right. So take note, basta mga echinococcosis or hydatid disease, mga diretso gina presobuzzer anti-P1, 'di ba? Mga P1 P1. Ayan. So again, echinococcus or hydatid cyst, it contains the P1 substance and can be used as a neutralizing substance for anti-P1 na antibodies sa blood banking na mga procedures. Okay? All right. So that's for Echinococcus granulosus. All right. Now for lab DX, diagnosis is still through the identification of cysts in the infected organ. Again, eggs we are not recovered in man because we don't have the adults. And of course, we use also serologic tests. Aside from that, we also use mga ultrasound, no? Mga radiography, kay makitaan man gyud siya na naay cyst sa imong organ. Immunological tests, again, your bentonite flocculation test, similarly seen in Trichinella. You have also a skin test known as Cassoni's intradermal test. You have enzyme-linked immunoelectrotransfer blood. More sensitive siya than ELISA, and you have also hydatid antigen dot immunobinding assay. So mga different serological tests, both detecting your antibodies and also antigen to your Echinococcus granulosus. All right. So again, skin test, Cassoni's intradermal test. Take note of that. So sa later part natin summary of all the skin tests, okay, in parasitology para easier na lang ang life. Okay? All right, sige. Now, next also, there could be microscopic examination of the hydatid cyst fluid. All right? What we use, we can stain it with eosin, 1% eosin. The non-viable scoliosis will be stained by eosin, and the viable, meaning alive siya, will not be stained by eosin. All right? Now, hydatid sand may not always be present. All right? And in older cysts, pwedeng ang hooklets na lang makita. So to detect hydatid sand, you centrifuge the hydatid fluid na mo nakita. You then put 1 drop of that on a slide and then another slide, and then imo siyang i-rub back and forth, and then if na grating sound, right, mura siya ka ng glass or grating, no, then that is due to the hydatid sand. All right, so glass grating on sand grain. So mura ka ng basa, mag-grate sila ba? Okay, I hope na-get siya ang sound. Great. Okay. Now, if the cyst fluid is purulent, we can liquefy it using concentrated HCl. We boil it for 10 minutes or leave at room temperature for 1 hour. Okay, and then we centrifuge and then examine for refractile hooklets. Okay. All right, that's for Echinococcus granulosus na method. So here is your hydatid sand. So kanina siya dears ang mga protoscolices. Ayan. So naka-invaginate, nakasulod imuhang mga scolex ani. Alright? And kani mga ginagmay na sa surrounding, those are the hooklets. Okay. Alright. So mga remaining na lang no na degenerate na siya ng mga protoscolices, ang nabili na lang kay ang imuhang hooklets. Okay. Now this is the staining no with scolices. As you can see, the viable ones are not stained. The non-viable will be stained. Okay, ayan. Because again, the viable are still parang motile daw. So they can still move. Ayan. Or they can still withstand the stain. Okay, dili nila masulod or ma-acquire ang stain. All right. Now, another method for the cyst is known as your for treatment, For treatment is of course surgery. Siya pa rin ang choice of treatment, no? Pero again, it depends on the site in the body. Na yung mga sites sa hydatid cyst na dili pwede ang surgery. Okay? So if dili pwede ang surgery, we can use what we call the pair method. The pair method, again, is minimally invasive, a higher incidence also of cure, and lower rates of complication. So your pair is an acronym, okay? And the pair stands for puncture, percutaneous puncture, all right? So meaning buslutan sa ang cyst, ayan, buslutan sa ang cyst, all right? Next, you aspirate. Okay, 10 to 15 ml of the cyst fluid. So ang point ana is you aspirate already the fluid sa sulod, okay? Because the fluid contains already, di ba, mga protoscolices, hydatid sand, daughter cyst. So tangtangon to sa to siya. All right? In case pod para if mabuslot siya or mo-rupture ang cyst, dili ra siya mo spread or dili siya mo leak. Okay? So aspirate. Next, imo siyang injectan, all right, of protoscolicidal solution, which is 95% ethanol or hypertonic saline. Hypertonic saline, 15%. Okay? 15% ang hypertonic saline. All right. Now, imo na siyang uh, injectan og protocollicidal because again para mga matay tong mga brood capsules kay naka-attach man siya sa germinal layer, di ba? So para mga matay to siya kay wala man to siya sa fluid mismo, dili man siya ga float, di ba? It's not free floating sa imong hydatid fluid. All right? So wala siya nakuha sa aspiration. So you then inject a protocollicidal solution to kill the germinal layer na mga brood capsules. All right? And then after injection, aspirate na pod, re-aspirate to determine or to get na gyud kato mga tangtang na brood capsules and the remaining pod na contents sa imuhang hydatid fluid. All right? So na-gets ra ang procedure. So pair, puncture, aspirate, injection, and then of course re-aspiration. All right? Now for chemotherapy, we can use albendazole or a combination of albendazole and praziquantel and also mebendazole. Pero albendazole ang mas preferred. All right? So again, that's pair. I hope na-get to siya. Puncture muna. All right? And then aspirate kung sa itong mga existing fluid na nasa hydatid cyst. Because again, the fluid already contains, di ba, a lot of scoliosis, no, hydatid sand. Next, after aspiration, you then inject a protocollicidal solution such as 95% ethanol or hypertonic saline, 15%. Because again, to kill no the mga naka-attach na brood capsules and remaining also na structures na naa. So after injection of the protocollicidal solution, you then re-aspirate to get nagyud, no? To get the remaining contents of the hydatid cyst. So ang hydatid cyst mismo, kuhaan mo siya contents, okay? Because again, in pair, usually, ginabuhat niya siya in mga sites na lisod i-operate. Okay, so at least man lang, if mabilin ang cyst yun katong structure, at least man lang ang sulod sa cyst, wala na yung mga scoliosis, alright? Or wala na yung mga daughter cysts, mga hydatid sand. Okay, so that's for the pair method for Echinococcus granulosus. All right? So that's for the first Echinococcus. Ang dami, no? So before we proceed to the next, your Echinococcus multilocularis. Do you have any questions? Any clarifications? All right. Okay, nandiyan pa ba kayo? Or carry pa? Okay. Okay, are you still okay pa mo, dear? Sapa mo? Laban lang.
Yes, sir.
All right, sige. So that's for Echinococcus granulosus, no? So siya first nato na Echinococcus species. Now the next is your Echinococcus multilocularis. Your Echinococcus multilocularis causes alveolar hydatid disease. So later we'll describe or we'll explain anong alveolar. Now, it's considered to be the most lethal of all the helminthic diseases. Ayan, di ba? So, siya ang pinaka-lethal. So, later we'll understand po nga, no? But again, siya ang pinaka-lethal daw. Now, habitat, same ragyapon siya with Echinococcus granulosus, small intestine for the definitive host, and your connective tissues for intermediate host. The final host are your foxes this time. So, dili na mga domestic dogs. Ang main yun nato kay foxes, alright? But it can also use wolves. Pwede po mga dogs pa rin or cats. Pero again, main nato kay foxes. Intermediate host are your rodents, no? Voles, lemmings, shrews, mice, and ground squirrels. Accidental intermediate host, kita gyapon man. Infective stage, still the same, no? To final host, hydatid cyst. Intermediate host is egg. Mode of transmission, same gyapon, ingestion of the egg. Now, please take note, dears, board exam question, recall March of 2019. I think, tama, 2019, basta the boards before ours, yes. March of 2019. The question was, which of the following is the intermediate host of your Echinococcus multilocularis? Naku talaga, lumabas siya, dears. And ang answer ato kay rodents, okay? So, natin question, ang choices ato kay letter A, sheep, letter B, rodents, letter C kay something. So if nalimot yung ka, di ba? Multilocularis is rodents, okay? Pero for your granulosus, Echinococcus granulosus, it is your sheep. Okay? So take note of that, dear sa lumalabas kahit intermediate host sa board exam. Okay? So intermediate host, lumalabas pa rin, you have rodents. Okay? So March 2019 board exam. Okay, ayan. Recall. Ayan. So take note of that. Okay, so do not take for granted mga intermediate host ha, and mga final host pa rin and modes of transmission kasi lumalabas pa rin sa boards. Okay? All right. So that's for Echinococcus multilocularis. Now for the adults, as you can see, similar gyapon siya. One caproglotid at each stage of development, but it's quite smaller than your E. granulosus. There are minor morphologic differences lang. Now the egg still the same, similar, no? With Tania, similar eggs with E. granulosus also, and also the life cycle similar gyapon. Ang difference lang kay ang definitive host which is your foxes, and also the intermediate host, which is your rats. Okay? All right. Or rodents. Take note, rodents. All right. Now, we go now to the hydatid cyst of your Echinococcus multilocularis. So, ano siyang deadly? It's because ang iyahang hydatid cyst, as you can see, wala siya definite, okay? Wala siya definite na outer covering, okay? Unlike your E. granulosus na makitaan gyud nimo na intact ang structure, like klaro gyud ang cyst, your E. multilocularis doesn't have an intact, no, laminated membrane, all right? And ang sulod pa gyud niya kahit series of chambers. So daghan kaayong mga chambers that contains again protoscolyces, all right? Or pwede siyang walay sulod, no? Walay sulod, little or no fluid and wala po'y scolyces, okay? Ang possibly pag yun, ang very important pag yun ani niya is that pwede siyang mo-spread, okay? Exogenously, no? Pwede siyang mo-spread to a lot of areas in the organ. So mura siya proliferative in the sense, okay? And it causes parang similar siya growth of cancer, parang ganun. So that's why it can be deadly. And pwede po siya mo metastasize. So murag siya cancer-like iyahang growth, okay? So abnormal, no, na murag cyst, wala siya characteristic yun na outer covering, or di mo siya maila na, okay, kani cyst yun siya, like intact ang structure. Unlike your E. granulosus. For E. multilocularis, that's why it's called multilocularis, kay multilocular. Daghang cysts, all right? Daghang chambers na na-produce, all right? And dili lang siya confined in one cyst, okay? Wala siya definite good na outer covering, wala siya definite cyst structure. That's why it's deadly. Possible siya mo proliferate, pwede possible po siyang mo metastasize. Okay? So murag cancer siya, iyahang appearance, iyahang growth. That's why sometimes pwede siyang ma-misdiagnosed as carcinoma. Okay? Because again, iyahang growth kay similar siya cancer, no? Na abnormal, pwedeng metastasize, all right? And pwede siyang mo proliferate sa imuhang organ. So possible dako gyud na tissue or organ, area of the organ ang affected. Okay. All right. Now, for symptoms and pathology, again, alveolar hydatid cyst. So why is it called alveolar? It's because iyahang outer covering kay nipis or wala gid siya laminated membrane, no? So mura siya alveoli, no, nato na medyo nipis and daghan po siyang chamber sa sulod. Di ba? Ang alveoli sa lungs, daghan po mga chamber sa sulod. So alveolar, ayan. Now again, the cyst grows slowly, similar with E. granulosus. So after pila pa ka years, possible mo gawas ang symptoms. So the same liver, ang most common site, and may disseminate. All right. And again, as I mentioned, mura siya carcinoma, resembles a slowly growing carcinoma. And lesions tend to spread by direct extension, meaning sa gawas, mura na siya mga galamay, all right, na mo extend siya to the surrounding tissues. And it can disseminate to the organs through lymphatic or hematogenous routes. In well-established disease, there may be hepatomegaly, splenomegaly, and also ascites. There could be right upper quadrant pain and hepatic mass, and there may also be shortness of breath if mabot siya sa lungs, and CNS symptoms such as brain metastases. So it's really deadly because again, pwede siyang mo proliferate, all right? And wala siya klarong end ba in terms of structure. Kaya wala dyan siya klarong outer covering, unlike your E. granulosus, alright, na klaro gyud niyang outer covering na cyst gyud siya. Ang imong E. multilocularis kay mo spread gyud siya, no, proliferative iyahang appearance sa imuhang hydatid cyst. Okay? Alright. Now for ultrasound or for lab DX, so the same ultrasound, CT scan, MRI, serologic tests such as ELISA, sandwich ELISA are sensitive and highly specific. FNAB can also be used, no? And these are stained with PASH and May Grunwald gem stain. You confirm it with PCR pa rin. And then aside from that, for treatment, surgery ang most common treatment. Pero total surgical removal is impossible because again, wala ka kabalo kung asa kutob, no? Asa kutob, asa taman ang imuhang cyst kay sige siya proliferate. Unlike your E. granulosus, as I've mentioned, na klaro gyud ang cyst na circular structure gyud siya kay na siya outer covering, outer wall na klaro gyud. Unlike your E. multilocularis again, gaspread siya, no? Proliferative iyahang lesion, mura siya cancer. So possible na dili gyud makuha tanan or difficult makuha ang tanan because you don't know kung asa siya kutob, no? Like wala siya klarong end, wala siya klarong outer covering. Ayan. So risk of metastasis also remains after surgery pa rin. Now, chemotherapy, albendazole and mebendazole na siya for inoperable cases. So lifelong treatment na siya, okay, of albendazole and mebendazole. All right, so that's for Echinococcus multilocularis. So proliferative ang lesions, it can metastasize. That's why it's known as the deadliest among all the helminthic diseases. Okay, so again, intermediate host, rodents, definitive host, foxes. So take note ha, lumabas ang imuhang intermediate host sa March 2019 na boards. All right, so take note of that. All right, next, for the last species of Echinococcus, your Echinococcus vogeli and Echinococcus oligarthus. Now, kanila na two species, usually rare lang kaayo pod, dili kay common, and it's common in the neotropical area of the New World. So sa mga ano gyapon, sa America, no, mga Central America, South America. Habitat is still the same for your E. granulosus and E. multilocularis. Final host, ang imuhang bush dog for E. vogeli, usara gyud sa E. vogeli, bush dog. Ang final host for your E. oligarthus are mga cats, no, wild felids. You have pumas, jaguars, and wild cats. Intermediate host is still rodents. All right, pacas, piney rats, agouti, and opossums. Accidental intermediate host is man, so the same infective stage. Hydatid cyst to the final host. Intermediate host ka embryonated egg. Now, mode of transmission is still in the same ingestion of embryonated egg. And now, for E. vogeli, life cycle, similar gapon with E. granulosus. Morphology, adults of E. vogeli may be longer than your E. oligarthus. The hydatid cysts are similar Japon with your E. granulosus but multi-chambered. So, ang difference lang niya is that iyahang cyst, unlike your E. granulosus na usara sa sulod, di ba? Unilocular, pwede siyang daghang chamber sa sulod. Alright? So, daghan siya mga divisions. Okay? That's for the hydatid cyst of E. vogeli and E. oligarthus. Now, for the disease that it causes, it's known as neotropical echinococcosis. For E. vogeli, it causes polycystic hydatid disease. No? So, it's different sa imuhang multilocularis because polycystic siya, meaning daghang cysts, pero ang cyst niya na ay klarong outer covering or na outer wall. Okay? Unlike your E. multilocularis, di ba, na wala, yun, namura siya og cancer, tumor, growth-like, inana, okay? So, ang imuhang E. vogeli, kay polycystic siya, daghang cysts, pero, again, na siya outer covering. Okay. Now, again, polycystic hydatid disease, it can be chronic, and advanced cases have high mortality. Liver pa rin ang most common site, and the most common clinical presentation involve the abdomen, na kay hard mass, connected to the liver. Ang imong E. oligarthus, unicystic hydatid disease lang. So usually usara ka cyst ang makita, all right? And it's fluid filled pa rin and siya mo enlarge siya padayon. Okay? So usara ka cyst usually ang makitaan pero sige siyang enlarge, all right? And it's not known to undergo exogenous proliferation, meaning dili siya mo spread. Okay? So unicystic ra siya. All right? Okay, so that's for E. vogeli and E. oligarthus. All right? So ang E. vogeli, all right, polycystic hydatid disease. All right? Daghan siyang cysts, all right, in one organ or pwede siyang other organs pod, pero ang iyahang cysts kay nay outer covering, klaro gyud iyahang outer laminated membrane, unlike your E. multilocularis na dili klaro. All right? Okay, so that's for E. vogeli and E. oligarthus. Now, for the laboratory diagnosis, again, imaging techniques, you have radiography, CT scan, ultrasonography. Serological tests do not always confirm the infection. You can use FNAB pa rin to confirm the cause of the mass. Example na ay patient na nagpa-FNAB, kaya wala siya kabaloon sa unsa ning mass na yun na feel. So, possible E. vogeli or E. oligarthus. And you can also use DNA analysis, PCR, or other DNA techniques, molecular methods. Treatment is still surgery, albendazole, or pwedeng combination of both. All right? So depende gyapon if the cysts are operable, if kaya ra sa kung asa nakita ng cyst. All right? So depende lang siya. All right. So that's for the Echinococcus species. All right. So before I proceed to the last, do you have any question, dears? Okay. Yes? Carry pa? Nandiyan pa ba kayo? Mubak lang to? Okay.
Nakapasok.
Okay.
Nakapa, sir.
Parang regrets na yan na akong mga namadunggan. Parang, okay. Alright. So that's for the three Echinococcus, no, species. So granulosus, multilocularis, and vogeli and oligarthus. The last of the tapeworms commonly affecting humans is your Tania spp. So kani siya actually, dears, it's another species of Tania. Pero this is the type of Tania gyud na tissue iyahang ma-affected. Okay? Ang T. solium and T. saginata kay usually intestinal, except for T. solium na cysticercosis. But for Tania multiceps or Tania cerealis, this really affects the tissues. All right? So Tania multiceps are also known as multiceps. Ayan. Pero Tania multiceps siya. So it causes what we call cynorrhosis in humans. Because again, larval form pa rin niya, which is known as cynorrhus, siya ang reside sa imuhang body. So again, it can be found within organs or sa imuhang mga muscles or sa other areas sa imuhang body. All right? It may cause destructive damage or death, but is a rare disease in humans. So identification to the species level is often very difficult, if not impossible. So if you want to identify to the species level, pwede ra siyang PCR gapon, DNA techniques or molecular methods. Now, final host, again, are dogs and foxes. Intermediate host, sheep, cattle, deer, and rabbits. Accidental intermediate host, kita gapon, humans. Infective stage are the eggs, and mode of transmission is ingestion of the egg pa rin. Ay, sorry. Dili hydatid cyst deers, paki-erase. It will develop into cynorrhus in man. Sorry. Okay? Sorry. Kanina spelling ha. Cynorrhus. Dili hydatid cyst. Pasensya. Okay? Alright. Sige. Now, for the adults, as you can see, the adult tapeworm is similar lang good siya with Tania. Alright? Na adult. But na siya proboscis. No? So, na siya tubular appendage or rostellum pa rin. With 22 to 32 hooks arranged in 2 rows. So, again, similar appearance lang with the adult Tania, Saginata or Tania solium. All right. Now, again, what's important is the life cycle. Because again, ang dogs, ang important yun. Sila ang makomplete sa life cycle. But kita, once we eat the eggs, again, the eggs will hatch in the intestine and the oncosphere will lodge in suitable organs. Because again, they can be carried by the blood. All right. And in the organs, they will develop into cynorrhus. The cynorrhus is the larval stage of your Tania multiceps. And again, they can be found in the eyes and the brain. And for T. cerealis, pwede siyang sa subcutaneous tissue. Now, what is cynorrhus? Ayan. So, ayan, that's the difference lang, no? Ang cynorrhus is unilocular cyst. Same na siya with cysticercus. Pero ang difference is that ang cysticercus, usara ang scolex sa sulod. Alright? But for cynorrhus, it's multiple scolices. Ayan, as you can see, daghang scolices ang nasa sulod. Alright? For cysticercus, with Tania saginata and Tania solium, usara ka scolex ang naa sa imuhang cysticercus sa sulod. But for cynorrhus, ayan, daghan kayo siyang scolices na nasa sulod. Alright? So, mura siya difference sa cysticercus and cynorrhus. So, your cysticercus is an intermediate between your cysticercus with a single scolex and hydatid cyst. Pero ang difference lang po, your cynorrhus doesn't have daughter cysts. Okay? Alright. So, your cynorrhus, wala siya daughter cysts. Ang naragod niya kay multiple scolices. Ayan. Okay? So, same ra siya with cysticercus. Ang difference lang yun kay ang cysticercus, usara ka scolex ang nasa sulod. Pero ang cynorrhus, daghan, no? Multiple scolices. So, here's an example of a cynorrhus. So, kaning mga white, diri mo ni siya ang scolex. Okay? And kaning siyang covering, that's the outer covering of the cyst. Okay? So, cynorrhus. Alright. Now, for the disease, again, humans, most of the cynorrhus can be found in the brain or spinal cord. But again, it can also be found in subcutaneous tissue. Cynorrhus in your skin or subcutaneous tissue, it results or para siyang mga nodules lang. Alright? In the neck also, if nasa sa neck, it could affect the neck movement and swallowing. And kung CNS associated siya, there may be various neurologic signs and symptoms, similar to cysticercosis. In the eyes, it could lead to intraocular and orbital infections with varying degrees of visual impairment. So here's an example. This is the cynorrhus, all right, found in the brain. So again, the best method pa rin of treatment is your, wala pa pala. Sorry. So obstructive jaundice can happen if nasa sa liver. Okay. Cynorrhus may also be similar in appearance to lymphomas, lipomas, neurofibromas, or pseudotumors. So marasag mga tumors, no? Now in the sheep, especially sa sheep, it causes what we call your GID, no? Unstable gait or giddiness. So meaning, dili siya kalaka og tarong, no? Unstable gait and giddiness. So that's known as GID, a disease in sheep caused again by Tania multiceps or cynorrhosis. Lab DX is again gross and histologic examinations of the cynorrhus after surgical removal, treatment, surgical removal, and if not, praziquantel. All right. So again, actually same ra siya og life cycle with Echinococcus, diba? Granulosus. You ingest the eggs and the eggs will hatch and they will become the larval stages in the organs. All right. But the difference lang is Tania multiceps, iyahang larval stage is known as the cynorrhus. Okay? All right. Cynorrhus. Ayan. Sige. That is for Tania multiceps. All right. And that's all for the common na mga human cestodes, all right, or human tapeworms. Before I proceed to the uncommon, mga dili kayo common, as mentioned. Any questions? Any clarification so far? Alright? Carry pa, laban lang. Okay, any questions? Kira? Nag-gets lang so far, dears? Ha? I hope nag-gets rin yun ang hydatid cyst, ha? Unsay mga sulod, ana. Kay for the longest time, nalibog yung kung saan ang sulod sa hydatid cyst. Like, what? Unsa di sulod, ana? Like, why is it? Unsa di mga brood capsules? So I hope nag-gets lang to siya. Alright? Any questions? Okay. All right, so we'll proceed now to the uncommon human cestodes. All right, so again, similar Japan with nematodes and trematodes, these are the uncommon ones. Okay, dili kayo siya maka-affect commonly, dili kayo siya ma-recover commonly sa humans, but they can still cause a wide range of disease. So we'll start first with Diplogonoporus species. No, so you have D. grandis and D. balaenopterae. No, so it's common in Japan. Normally found siya in whales. The eggs are similar to D. latum, as you can see, no? Operculated siya and na siya kaning knob opposite the operculum. And the mode of transmission is still consumption of raw anchovies, mga fish na gamay, or sardines containing the plerocercoid larva. So same ra siya with D. latum. But again, not commonly recovered naman. So less lang siya. Less cases lang have been reported. And it's quite common in Japan. So Diplogonoporus. So it also contains two sets of reproductive organs. Okay, so aside from the caninum, napod siya two sets of reproductive organs. Diplogonoporus species. Next, you have Bertiella species. A very important species is Bertiella studeri. It was first recovered from an orangutan. And it's found in Africa, India, Southeast Asia, and Philippines. All right. Eggs, na siya oval shape, irregular oval shape. A delicate middle envelope, ayan, nasa tunga. Ang makitaan, and ay protrusion on one side. Kani protrusion. As kani siya, dears, mo siya na inawong yun as in. Like, galanto ko, shocks, mo siya na inawong. But anyway, ayan. Mode of transmission, accidental ingestion of the mites, no, insect containing the cysticercoid larva of the worm. Patients may be asymptomatic, or there could be vague intestinal disturbances. All right. So for the life cycle, ayan, as you can see, mite, all right, pwede ma-ingest sa humans accidentally, and dito na ito makuha ang infection. All right. But again, the main definitive host are your monkeys. All right. Orangutans. Okay. All right. Next, you have Intermicapsifer Madagascar. Sorry. So wrong spelling na siya dear siya. Madagascariensis na siya. Wait, ako na lang i-edit. Madagascariensis. Ayan, sorry, Madagascariensis. So it's often seen in humans in Havana, Cuba. Arthropod vector is still thought to involve in the infections, pero wala pa naibalaan kung unsang arthropod vector. Symptoms are vague, but there may be anorexia, weight loss, abdominal pain, or irritability. All right. Diagnosis is performed by finding the rice grain-like proglottids, similar with Raeliatina species. So here is an example of your proglottids, di ba, Marsha, rice, and this is a proglottid that contains the eggs. So the eggs are found in an egg capsule pa rin. Okay? Alright, so nasa egg capsule chapot. For the life cycle, as you can see, wala pa naibalan kung unsang intermediate host. Alright, so it's still being studied. Alright, so ang mode of transmission is still the ingestion of the intermediate host containing the cysticercoid larva. Okay, alright. But again, rats ang main definitive host niya. Alright, okay. And again, egg capsules are passed into the feces. Okay, so egg capsules yapon siya. Alright. Next, you have Raeliatina salabensis. So again, similar siya with your Raeliatina garrisoni. So it's common in rats, found in humans, especially in children. And the mode of transmission is accidental ingestion of the intermediate host. All right. So nagya po'y egg packets. All right. And symptoms disappear after treatment with niclosamide. All right. So same magyapon siya with Raeliatina garrisoni. All right. Okay. Next, you have Mesocestodes spp. Your Mesocestodes spp, again, is an adult worm or intestinal parasites of wild animals, such as primates, carnivores, and the birds of prey. The infective stage is tetrathyridium, so lahiyahang larval stage, and that is tetrathyridium. Mode of transmission is the ingestion of inadequately cooked meat of some animal that serves as the intermediate host. So if nikaon mo like primates, birds of prey, carnivores, so possible ni mong nakuha dito. And the proglottids, very important, iyahang description looks like a sesame seeds. Ayan. So actually, pag nato nakuha ni mo siya grocery. Okay, sorry naman. Pero para siyang rosary for me. Ayan. Pero sesame seeds daw iyahang proglottids. Okay, so take note of that, dears. Ayan. So here is the life cycle. Iyahang larval stage again is known as tetrathyridium. So lahi siya na larval stage sa rest of your tapeworm. Okay? So again, nakuha siya sa snakes, pwedeng frogs, and other intermediate hosts. Alright? If nakaon ni mo na siya, then possible ni mong makuha pod ang Mesocestodes species. All right. So again, sesame seeds na proglottids. Okay. Now, Tania crassiceps, another species of Tania, but again, very not common. Similar life cycle with T. multiceps. Common tapeworm of the red fox. Intermediate hosts are still your small mammals, no? Mga mice, rabbits, and rodents. Larval forms found under the skin and body cavities in animals. Human cases are rare and usually makitaan siya in patients with immunosuppression. Okay? As you can see, muna siya ang imuhang cyst, all right? And cysticercosis, okay? And you have here again, kanina ay mga white, that's the scolex, okay, na naka-invaginate. All right? So Tania crassiceps. All right. Next, you have Mathevoitania species, the last. It's described from a patient in Bangkok, Thailand, following niclosamide treatment. So after niyang treatment with niclosamide, na nakita ang tapeworm, and that is Mathevoitania species. So it resembles your Mathevoitania symmetrica, common intestinal tapeworm of your rodents, all right? Diarrhea associated with the infection resolves after antihelminthic treatment. So here is the scolex, this is the body, and this is the worm. Okay, so that's for Mathevoitania species. All right. And again, summary na lang of mga eggs na to. Common yun, mga gravid proglottids. Don't forget ha, T. solium, T. saginata, kinsa itong mas daghan og uterine branches, di ba? Atong mnemonics, T. saginata, mas daghang syllables, iyang ngalan. So siya ang mas daghang lateral branches. You have dilatum, di ba? Central uterus, highly coiled, rosette uterus. Decaninum, double pored, duha ka genital pore at each side of the proglottid. Okay, ayan. And then you have the scolex. Take note again, as mentioned, kinsa itong mga armed rostellum. And again, dilatum, lahi iyahang appearance, di ba? Sucking grooves, known as bothria. Okay, so take note of that. So lahi siya itsura, no? Yes. More siya katong monster sa Stranger Things, charot. Emela. Okay, ayan. Next, for the eggs of the very common eggs of your tapeworms, again, Tania. As you can see, striated cell, golden brown in appearance, no? And again, the two species of Tania cannot be differentiated from each other based on eggs alone. All right. Then of H. nina, again, polar filaments with bipolar thickenings. H. diminuta, bipolar thickenings, pero walay polar filaments. And di ba, I shared to you kung say difference murag limpyo, di ba? Limpyo ang murag cytoplasm or kaning naa sa kilid sa imong H. diminuta, whereas ang imong H. nina medyo hugaw because of the polar filaments. All right. Dilatum, again, operculated, abopercular knob, opposite, no, the operculum, and you have decaninum egg packets. Okay, egg packets, egg capsule, press the buzzer. That is for decaninum. All right, and a summary na lang of skin tests, dears, in parasitology. Sa tanan-tanan na siya, you have ascariasis, the Mohn test, di ba? Hydatid disease, Casonis, intradermal test. Trichinosis, Bachmann. Kala-azar, dum-dum fever of Leishmania, di ba? You have Montenegro, Leishmanin test. Toxoplasmosis, your Frenkel's or toxoplasmin test. And for schistosomiasis, you have Fairley's test. Okay, please take note of that. Mga skin tests, all right, lumalabas pa rin. At least aware na kayo. All right, so don't forget that. That's the summary of the skin tests in parasitology. All right, okay. So before I proceed to the last topic for today, the arthropods, no? Any questions so far, dears? Any clarifications? Almost done, yes. Okay. All right. So, kaya pa ba? Laban pa? Okay. Unsa ka itong stain atong pwedeng gamiton para ma-visualize ang uterine branches sa imong Tania solium or Tania saginata? Your yes, kalimutan agad. The stain that can be used to visualize uterine branches of Tania solium, Tania saginata. Your unsa to? Unsa to, dears? Your yes. Your unsa man to na stain?
India Ink.
Okay, India ink. All right, don't forget that. All right, sige. Any questions before I proceed? Okay, sige. So we'll continue now with the last topic, the arthropods of medical importance. No, so these arthropods usually are ectoparasites. Okay, but your arthropods can be of different functions in terms of being a parasite. Okay, they could be ectoparasites, yes. They could also be mechanical vectors, as we have mentioned, no? But most of the time they are biological vectors, no? So for the longest time in our discussion in parasitology, we have already mentioned a lot of intermediate hosts, usually, or definitive hosts that are insects or arthropods, no? So most of the time, the arthropods of medical importance, usually they are functioning as a biological vector. So meaning they are really part of the life cycle of the parasite. Okay, but there are some insects, arthropods, Japan, that are functioning, no, as ectoparasites, diba? And when you have ectoparasite, you have an infestation. Okay, diba? And that's what we're going to talk about now. All right, but again, heads up lang, so dili siya pod in depth. Okay, wala man dili ta entomologists, all right? So ato ra i-focus ko to mga important yun. All right? So that's for the arthropods of medical importance. Now, general characteristics, 85% of known animals are arthropods, no? So majority gyud of the animals found in the world are arthropods, okay? Mga insects, ayan, or other arthropods na phylum, a class, okay, ayan. Now, they are bilaterally symmetrical, meaning, again, they can be divided into two equal parts. And invertebrate animals, wala sila backbone, all right, of course. Segmented bodies, na sila mga appendages, all right? And there could be hard outer coverings or exoskeletons. Now, again, metamorphosis, di ba, is the change in form or structure of your arthropod during period of development, di ba? So sa mga speeches, di ba, sa tuwang kanang mga debut, mga kanang sana, mga mga inana na birthday, di ba? Naman yun ang word na metamorphosis as you undergo metamorphosis, MS. So that's metamorphosis. So change in the form or structure of an arthropod during period of development. So there are two types. You have gradual or incomplete. Ang imuhang incomplete lang kaya siya 3 stages. It starts as an egg and becomes a nymph or a larva and then becomes the adult. So this is seen in cockroaches, grasshoppers, lice, and bugs. Now, the complete life cycle or complete metamorphosis, upat yung stages. Egg, then you have the larva, and then pupa, and then you have the adult. So this is seen in mosquitoes, flies, butterflies, moths, ants, beetles, and wasps. Okay? So ang difference lang yun sa duha ka types of metamorphosis is that ay muhang gradual incomplete na siya nymph. Okay? And that is the larva already. Okay? And wala siya pupa na stage or murag dormant na stage. Okay? Now, the body of the insect is divided into 3 regions. You have the head, the thorax, and the abdomen. All right. So again, this is your metamorphosis. Ayan. Simple. Ayan. It starts with an eggs, become a nymph or larva, and then becomes the adult. For complete, you have eggs, larva, pupa, which is a dormant stage, and then finally adult. Okay, so 4 stages in complete metamorphosis. Okay, and the body of a typical insect, you have the head, the thorax or parang chest, okay, and then the abdomen. Okay, all right, that's for the arthropods na body parts. So we'll start first with the head, okay, the external anatomy. The head contains the eyes, all right, the antennae, all right, mga antenna, and also mouth parts. Now for the eyes, there could be 2 types. You have the simple eyes or ocelli. These simple eyes contains only one, no, single eye units or facets. All right, and then usually sa compound, mas intense na, mas daghan na siyang sulod. All right, it may be large, may be round, oval, or kidney shaped. Now, the simple eyes or ocelli usually are used to detect movement, and these are mga light sensitive, no? Light receptor na mga parts or organs sa imong insect. All right? Now, for the compound eyes, usually sila ang mo provide og image sa environment, or it has a wider view of the environment, and it's also used to detect movement. Okay? Now, there are some insects na ang naara nila kay simple eyes. Okay? Wala sila compound eyes. Napoy uban na compound eyes siya, wala simple eyes. But most of the time, they have both. Okay? Alright. So, again, simple eyes, usually for light receptors lang, light detection. They don't form an image of the environment. Ang compound eyes, usually siya mo form sa image and wider ang iyahang view sa environment, ang imong compound eyes. Okay. Alright. So, that's for the eyes found in the head. Next, you have the mouth parts, no? So there could be a lot of different mouth parts. You have chewing mouth parts, sponging, piercing, sucking, and chewing, lapping. All right, so for chewing mouth parts, you have cockroaches, silverfish. They are used to grind solid food. Sponging, it's for sucking up liquid, such as your housefly. Piercing, sucking, such as mosquitoes. Ana siya proboscis. So yung buslutan gyud ang skin ba or asa kung asa siya makuha o food. And then chewing lapping, it's for grasping prey, and molding wax for nest material. So same, or it's seen in your honeybees. Okay. Ayan. So here is your parts. You have chewing. Ayan. Letter B is chewing lapping. Letter C is you have sponging, di ba? So you can see, marshag siphon, pwede siyang musuyop. Ayan, sana. And then D, you have piercing sucking. So na siya proboscis, kani siya. So it's for piercing, no? Yung buslutan ang host, ang skin sa host to get the blood ba or whatever. So again, seen in mosquitoes. All right. So that's for the mouth parts of your insect. Okay. Next, we go now to the thorax, or your chest area. All right. So it's connected to the head by the neck or cervix. It has 3 segments: the pro, mesa, and the metathorax. If na wings imuhang insect, it's connected in the mesa and metathorax. Okay. So wings are membranous extensions of the body wall. And of course, wings are used to fly. Okay. Para sila for movement. Okay. To move from one area to another through flying. Okay. All right. Now for the legs of your insect, they're divided into the coxa, ayan, trochanter, the femur, tibia, and then of course tarsus and pretarsus. At the peak of at the pinaka end, it has a pair of claws, or known as pulvilli, ayan, which help insects in walking on smooth surfaces. Para di sila ma-slide, okay? Para makagrasp sila, all right, sa imuhang smooth surfaces, all right? So that's the structures of the leg, no, of your insects. Okay. Now, for the internal anatomy, of course, napun sila yung mga different body systems. So starting first with the circulatory system, their blood is colorless and they have hemocytes, which are phagocytic. Circulation is maintained by your hemolymph, and blood from the heart is forced yung aorta kay naadiri, all right, padulong sa brain. And the entire body cavity is known as the hemocell. All right? So, ang sulod gyud sa iyahang circulation, or sa sulod gyud sa iyang body cavity, that is known as hemocell. All right. Next, for the respiratory system, their respiratory organs are in the surface of their body, and they are known as spiracles or spiracles. These are circular openings, ayan, na nasa gawas, and these serves as the opening, no, for the air to enter the body. All right, so spiracles. All right. Next, for the nervous system, of course, consists of a brain, na nerve cord, may mga ganglia, all right, and different nerves arise from different ganglia, padulong sa different parts of the body of the insect. Okay. Now, for the digestive system, it has the foregut, which contains mouth, pharynx, esophagus, and proventriculus. Oh my gosh, lami ka ng provendiers. Dili sa insect, ha, sa chicken, sa Cebu, if nakatry mo, shucks, my God. Proben, yes, ang lami yun. So if mato mong Cebu, ayan, if mukhaon mong proben, ayan, that is short for proventriculus. So nana sa chicken pod ang proven. All right, nana siya sa, if damo sa Cebu ma-assign no mga chongwa or soto mag-intern, tikaon mo mga proven, may cash ang sarap. Nana siya sa Fuente dapet. Nasa Fuente Circle sa BDO. Ayan. Okay. Ayan. So try nyo guys ha if maato mong Cebu. Lami kay siya. As in. All right. Anyway, saliva composition of your insect, it varies, but most of the blood-sucking insects have anticoagulants. Of course, para dili mo coagulate ang blood, di ba? Pagsak nila, no, pagkaon nila. All right. Ayan. Now, midgut contains the stomach, an area for food storage in the process of digestion, and the hindgut, or towards the end, contains malpighian tubules. And these malpighian tubules are part of the excretory system. These are excretory filters that discharge waste products. Okay, so from the midgut, hindgut, muagi na ang mga waste products sa malpighian tubules, padulong sa iyahang excretory organ. Okay, all right, sige. And then you have the reproductive system, of course, they are dioecious, charot. Separate, no? Separate. You have a female insect and you have also a male insect. Ayan. So dioecious, male and female must mate before the eggs are produced. Senses, they also produce sense of sight, touch, hearing, smell, and sight. And taste, they may also have a sense of balance and orientation. Ayan. So that's for the internal anatomy of your insects. Okay, so we go now to the different classes of arthropods that are important. So you have the crustaceans, which contains the crabs, lobsters, shrimps, and copepods. Antony, you have 2 pairs and the legs 5 or more. Arachnida, your mites, ticks, scorpions, and spiders. Again, legs kay 4. Arachnida, di ba? 8 na sila ng mga legs. Hexapoda or insect, the mosquitoes, flies, lice, and bugs. 3 pairs or 6-legged na sila. Chilopoda, centipedes, 1 pair of antennae, 1 pair of legs. Diplopoda, millipedes, one pair, two pairs, and then you have also the pentastomids or pentastomida, the tongueworms. These are worm-like um, insects that are related to the arthropods. Okay, pero worm iyahang appearance. Okay, ayan, that's pentastomids. Zero antennae, zero legs. Because again, they are worm-like in appearance. Okay, so we go now to the different insects no affecting humans, okay, or arthropods, no. So again, ano lang dears, we're just going to gloss over and then mga pictures kung saan na itsura and then possible diseases po nilang makos. Okay, all right. So we'll start first with order Diptera, which are your mosquitoes and flies. So later, ito na siyang nasa later part ng mga pictures. Next, you have Anoplura or your sucking lice. So kanina sila mga lice, no? Mga kuto. Ayan. So you have the head or human body louse. You have Pediculus humanus capitis, which is found in the scalp. And please make this dears, edit this to Pediculus humanus corporis, which is found in the body. Okay? Pediculus humanus corporis is sa protected parts of the body. So that's the body louse. Okay? And the pubic or crab louse, your pteros pubis. Okay? Ayan. So as you can see, it's known as, or it's described as crab louse because iyahang appearance mo siya crab. Okay? Ayan. So, Anoplura. Okay? These are the sucking lice, meaning musak it's like blood. Okay? Now, head louse, of course, your Pediculus humanus capitis. I'm sure na iba ninyo nakatry naggikuto sa bata sa una, no? Okay, mag-amina na kayo, dears. Okay, huwag na kayong mahiya. Charot, that's normal sa una, di ba? So usually your kuto sa head, they can be transmitted through direct head-to-head. Meaning, if bata ka, like matapot imong head, okay, to someone na naikuto, or imong hair manggani matapot dito, or you use combs, mga hats, inana from a patient or from a person na naikuto. So dito siya makuha. Okay, so far ako na-balance sa una, mo jump daw, no? Mo jump daw imuhang kuto padulong sa imuhang tapad. No, your head louse doesn't jump. It moves by crawling. Okay, so 'di ba? Now I learned, no? Sa una gyud ako ma-remember kay gi-mention na siya, mo jump daw siya. But karon again as I read, mo crawl siya, dili siya mo jump. And makuha nimo ang kuto if duol kag someone na naikuto and then nag head to head ayan na-touch imo ang head to the head of someone na naikuto, or you use mga materials, no, combs, mga hats, no, from a person that has the head louse. Okay, so that's for the mode of transmission. For pubic louse, crab louse, usually it's sexually transmitted. Okay, because makita niyo sa imong pubic hairs, of course. Aside from that, pwede nimo siya makuha if matulog ka in beds, all right? Matulog ka in beds na that contains the crab louse, or natulog ka sa bed na gikatulgan pod sa someone that has pubic louse. Okay? So, wala siya possible sources of infection. Of course, usually sila ang ma-exhibit lang sa humans kay katul, no? Itching, mga pinaakan, inana. Okay? So, that's for Anoplura. The sucking lice, musak sila og blood. All right. Okay. That's for the lice. Again, mga species, Pediculus humanus capitis, your head louse, and body louse, you have P. humanus corporis. And again, crab louse, your Pteros pubis. Okay? All right. Next, you have your Siphonaptera. Yeah, Siphonaptera. No, these are fleas, usually mga intermediate host of Dipylidium caninum, katong Synopsilla, rat flea, dog flea, cat flea. Now, another very important one is the chigo or sand flea, known as Tunga penetrans. It causes what we call tungiasis. Ayan. So, pasensya sa mga, yan, giluod po ko galantaw ani. Alright? So, your tungiasis or Tunga penetrans infection happens when humans, okay, example, magtiniil sila, no? Or gatsinilas, and then nasa sa mga sandy areas, no, usually. And then these flee kay mo jump padulong sa skin. Now, once na siya sa skin, mo burrow, no? Musulod siya sa skin, all right? Iyang head kay nasa sulod, and kaning black dot is the posterior portion of the flea. So kaning black dot nakitaan, that is the lubot, no? Lubot of the flea. Now, the female becomes gravid, all right? Ang musulod nato is ang gravid na female, na Tunga penetrans. Now, sa sulod, once manurture siya sa blood, iyahang i-release ang eggs through this. Munang nakagawas ihang lubot. Kay dira man mo gawas ihang egg. So kaning black kani siya, that's the back, no, or the lubot of the Tunga penetrans. Okay. Now if dili siya maagapan, pwede siyang mo penetrate further, makakause siya mga ulceration, and this is what happens, no? Magbusot-busot ng tiil, all right? And there could be ulcerations. Ayan, this is tungiasis na severe. All right? So that's tunga penetrans, all right? Again, the sand flea, chigo or sand flea. Okay? Chigo flea or sand flea. All right? So again, tungiasis. Luod ka siya lang tawon dear sa singalain ako paminaw. Charot, galantaw. Okay. Ayan. Next, you have order Hemiptera. And under this are your bed bugs, no? Your Cymex species. So, of course, sa pangalan na bed bugs, no? Bed bugs, nasa beds usually. Kanang makita na to na magkatul ka because na mamaak ni mo sa bed. Yes, that's your bed bugs. And bed bugs can also be transmitted or can be carried by mga luggages, mga bags, no? So, example, if niadto ka example, nag-hotel ka and the hotel contains mga bed bugs, pwede silang musulod sa imuhang maleta and then pwede mo siyang madala po sa inyong balay, nana. And once na siya sa balay, pwede na siyang muadto sa mga suok-suok, okay? Because your bed bugs love to reside in mga crevices, mga suok-suok sa imuhang body, sa imong house, okay? And again, in the bed, dito sila mo cause of infection. Mamaak sila, ayan, kani siya. Simicosis or mga paakan sa imuhang bed bugs. Ayan. So, muna siya imuhang chief complaint. Magsigkatul, no? Na ay mamaak and it will leave you restless. Maglisod ka katulog kay siging katul. Ayan. Okay. Now, there was an episode again in Monsters Inside Me Dears na may mga arthropods, no? Ang usaan na kay bed bug, no? Ang Cymex species. And then nakuha niya siya from luggage. Kay ni travel siya somewhere, nag-hotel siya, and then nadala di ay niya siyang luggage ang bed bugs. Now the luggage, pag uli niya, ang bed bugs ni hawa or ni gawas na siya padulong sa iyang bed sa balay. So dito na cause ang infection. So that's Monsters Inside Me na episode, bed bugs. Okay. So again, sa pangalan na bed bugs colonizes the beds, mama-action mo while natulog ka or naghigda, which is very inconvenient and annoying kay dili ka katulog kay katul. All right. Next you have Acarina. Now dears kaning Acarina di ay please take note, it's under class Arachnida. Okay, dili insecta. So palihog lang kog change or para di mo malibog. Acarina, it's an order under class Arachnida. So meaning same siya class with the spiders. Okay, pero wala na ako siya na-edit diri, pasensya. So Acarina, again, these are the ticks this time or mga mites, no? You have the trigger mite, also known as red bugs, harvest mites, or berry bugs, your Leptotrombidome species. So again, pakan na gyapon, trigger mite infection, no? Pruritus, katol, and then mga reddish ulceration or mga ginagmay na mga pinakan. All right? So that's for trigger mite. Next, you have, of course, scabies. Ayan, your itch or burrowing mite known as Sarcoptes kbi. All right. Now, your Sarcoptes kbi can be transmitted through direct contact with a patient positive or having scabies. All right. And these scabies will burrow, sulod yun sila sa skin and muna siya ang makos. Mga katul-katul ra gyapon, no? Ulceration, mga pustules, or mga reddish na mga katul-katul. All right. And again, this is caused by Sarcoptes kbi. All right, so itch or burrowing mite. Please take note. All right. Next, you have also your follicle mite known as Demodex species. Ayan, so scary siyang appearance, no? Medyo siya basta sa mga Stranger Things charot. So follicle mite is Demodex, so nasa pangalan na, it resides in the sebaceous glands, no, of our hair follicles. So here's an example in eyelashes. Ayan, itong maraga protrude. That is Demodex. Usually, ano ra siya, dili siya mo cause yung intense na mga symptoms, no? It's more on, mura siya nuisance lang siya, mura siya kanang sagabal ba, okay? And there have been reports na it can also cause blackheads, okay? Imuhang Demodex species, okay? Follicle mite. All right. Next, of course, different mites. You have the cheese or grain mite, your Acarus species. You have the house dust mites, your Dermatophagoides species. Your house dust mites, very important in the pathology of allergies, no? So, kana mga allergic to dust, it's possibly due to the house dust mites, no? So, pwede ka makakos og eczema, allergic rhinitis, yes, that's me. And then other mga allergic reactions. So, ako, I'm allergic to dust, no? So, yes, possibly allergic ko sa house dust mites. So, the house dust mites usually are important because, again, they cause allergies. All right? So, sa dust. Ayan. House dust mites, your Dermatophagoides species. Ayan. So again, they're under Arachnida deer siya. As you can see, upat ilahang legs. So 8 kabuok. Ay, so 8 ilahang legs di ay. So marashag spider. They're under the same class with spiders. Okay, so again, class Arachnida ni sila deers, ang Acarina. Okay, all right. Next, you have the ticks, the soft tick, and the hard tick. So soft tick is Argacid species. As you can see, medyo soft yung appearance, no? And then yung hard tick kay hard ang appearance. So if maka-remember mo, Ixodes species, mga ticks, di ba? This is a vector of Babesia. All right, and usually mga ticks, kani sila ng mga ticks, soft ticks, hard ticks, aside from transmitting protozoa, such as Babesia, they can also transmit bacteria, no? Mga Rickettsia, all right, and mga spirochetes din, pwede po. All right, so usually mo na ilahang importance kani mga ticks, soft ticks and hard ticks. Okay, next you have myiasis, no? Myiasis is the infestation or invasion of tissues by fly larva, no? The larva of flies, no, reside siya within tissues of humans. All right, now a very good example is the primary human botfly, Dermatobium hominis. Ayan, so botfly, so parang ako ito, charot, ML lang. Okay, so primary human botfly, Dermatobium hominis. So what happens is the flies kani siya, correct, female flies, mo-hijack siya og mosquito. Mukuha siya og mosquito. And then pagkuha niya mosquito, iyang ibutang ang eggs niya sa abdomen sa mosquito. O di ba? Grabe siya ka tikasan, no? Mukha siyang mosquito, iyang i-hijack ang mosquito, iyang butangan og eggs niya ang abdomen sa mosquito. So ang mosquito pagpaak niya og animals or humans, katong eggs na nasa mosquito abdomen mo hatch into larva. And these larva will then penetrate or mo burrow siya sa imuhang skin. And this is what we recover. Ayan, the Dermatobium hominis na larva. And that is known as myiasis. Okay? The botfly larva, again, caused by Dermatobium hominis. So, muna siya makita nimo. So, ang makita nimo is murag, na kayo ma-feel na murag na-move sa imuhang scalp ba or sa skin kung asa siya nakakos og infection or kung asa siya nakasulod. So, muna na-move. And then, medyo sakit po siya, no? So, ayan. And pagkuha nimo, ayan. So, that is the larva na makitaan. Okay? So that's one of the species that causes myiasis. Again, na ay larva sa fly sa sulod sa imong lawas. Alright? Or sa imong skin, sa scalp, or usually sa subcutaneous tissue. Okay? Alright. Next, another species is your primary screwworm in the New World, your Cochleomia hominovora. So as you can see, screwworm yung iyang ngalan kay Marshall screw in appearance. Okay? Another one is old world screwworm, Chrysomia bezayana. Okay? Ayan. Next, you have also tumbu fly, known as Cordylobia anthropophaga. Ayan, so here's an example. So kanina siya sa skin, kaning nakakita na yellow, muna siyang larva niya. Alright? And also you have the drone fly, Eristalis tenax. Iyahang maggots or larva is described as having rat-tailed. So muna siya, naiikog. Alright? Rat-tailed maggots or larva. So ang larva sa imong fly is also known as maggots, di ba? Ayan. So these are flies good that can cause myiasis. Not all flies can cause myiasis. Kanilang sila. Alright? Again, these are flies that deposit their eggs, pwede diretso sa atong tissues, sa atong skin, or pares ni Dermatobia hominis, iya pa ibutang sa mosquito, and then pagpaak sa mosquito nato, the eggs sa abdomen sa mosquito, mahimong larva, and then mo penetrate na sa atong skin. Alright? And makakuha tag larva, fly larva sa atoang skin. Okay, that's myiasis. All right. Next, we're going to do different flies lang, no? Very important na mga flies. Usually, these flies are mechanical vectors, no? They can transmit a lot of parasites and also mga bacteria po. So you have the common housefly, Musca domestica, the flesh fly, yung abdomen na ay checkerbird appearance, as you can see, marashag sa chest, di ba? Sarcophagus species, blue bottlefly or blowfly, Califora species. You have also the green bottlefly, Lucilia species, and you have the bronze bottlefly, Phoenicia species. So marashag na ay bronze na appearance. All right? So again, most of these flies are for mechanical transmission of your parasites. You have the non-biting stable fly, Mucina species, and the lesser housefly, Phania canicularis. So kanisa mga flies, again, usually they are important because of transmission, no? Mechanical vectors for different parasites and pathogens. Next, of course, oh my God, your cockroaches. Your cockroaches. Very popular is American cockroach or Periplaneta americana. All right, so it's chestnut brown to reddish brown in color, the largest of the three species of domestic cockroaches. And for the pathogens recovered, according to UP PGH, College of Public Health, na nakitang ascaris, excuse me, trichuris, bacteria such as Proteus, Escherichia, Salmonella, and Citrobacter. But again, that's not all, okay? Daghan pag yun. Your cockroaches actually parang siya tanan ang daghan yung gidala, okay? Ng mga pathogens. Because aside from parasites and bacteria, na po siya yung mga fungi, no? So, daghan yung kaayo, no? So, ew. So, I hate cockroaches, good dears, no? If kani siya mugawas ni siya sa CR na naligo ko mugawas jud ko bahala naghubo ko. Okay? I don't care. Basta og naa ni siya. I don't like you. This is my greatest fear. I don't like cockroaches talaga. So please, yeah, ayaw jud ko ipadulog cockroach. Okay ra gyud ko lizard, mice, spider, okay ra gyud ko. Pero kung cockroach, just ko marahog mamatay. Okay? Especially this, no? So, Periplaneta americana, American cockroach. So, daghan kayong pathogens siyang dala, dears, not only here, kaning listed, daghan pag yun, no? Tanan, medyo siya na yun ang daghang pathogens na dala, okay? Sa mga mechanical vectors. So, again, the importance of cockroaches and flies, usually, they facilitate mechanical transmission of pathogens, okay? All right, ayan. Next, you have the German cockroach or your Blatella germanica. So pale yellowish brown in color. You also have the Oriental cockroach, Blatta orientalis, dark brown to black in color. So as you can see, medyo wala kay ko kitaan ni. So ang pinaka-common sa Philippines mo rin katong American cockroach, Periplaneta americana. Galayan akong paminaw galantaw. Anyway, ayan, that's for the cockroaches. The very important again is mechanical transmission. Aside from that, they can also release allergens, no? Cockroach allergens. So those that are allergic can also be triggered by the allergens released by cockroaches. But majority of their function is really for transmission, mechanical transmission of the pathogens. Okay, now we go now to your mosquitoes. Yes, mosquito-borne diseases for dengue, hemorrhagic fever, of course, your Aedes aegypti and Aedes albopictus. So I'm sure you're all familiar with this na, public health pa lang, no? Ato ang examination of the larva of mosquitoes, di ba? Aedes aegypti, tiger mosquito, na siya white bands sa ihang legs and breeds in clear water and causes urban dengue. Ang Aedes albopictus actually similar sa appearance, all right? Pero rural dengue iyahang ginakos. Okay, and di ba remember sa imuhang larva sa mosquito, di ba we look at the comb scales and di ba ang comb scales sa imuhang Aedes aegypti na siya lateral dentricles, di ba? So muragnay ana and then na siya pakilid. That's for Aedes aegypti, and then ang Aedes albopictus kay wala siya kanang lateral denticles, di ba? So remember ato ang public health dyan. Okay, ayan. So that's for the Aedes species causing dengue, hemorrhagic fever. Okay, all right. Next, you have malaria, of course, Anopheles flavirostris, atong main. Ayan, this one. And there are also other vectors, Anopheles littoralis and Anopheles balabacensis. So these are different mosquitoes for malaria in the Philippines. But ang main nato for the Philippines is Anopheles minimus variant flavirostris kanisha. Anopheles flavirostris. Okay. Next for filariasis, of course, is the Aedes, no? Aedes posilus. Muna siya ang main gyud nato sa Philippines. And it can also use Mansonia species. All right. Okay. And next, you have the Japanese encephalitis disease, which is a viral disease. In the Philippines, it's transmitted by Culex Tritenurynchus. Okay? So Culex ang nag-transmit. So Japanese encephalitis. All right. Okay. In the Philippines. All right. So as you can see, among the vectors, dears, ang mosquitoes yun ang nagdala, no, sa majority of parasites and also diseases po. Because aside from parasites, pwede po siyang magdalag virus. So if mangutana gid mo what is the main vector or the vector that is involved in a lot of diseases, then it's the mosquito. Daghan gid siyang dalang sakit. Okay? All right, ayan. Next, we go now to your pentastomids. Your pentastomids are again tongueworms, no? So they are parang in the middle of a worm and an insect, but it's a different class, no? It's a different group of parasites. So tongueworms species are your Armilifer, Linguatula serrata, and Sebicia spp. So again, they're classified between arthropods and annelids or worms. Humans as intermediate host, the infective larva will die in situ or inside of us, no? So when mature larva are ingested, they migrate from the stomach, they attach themselves to nasopharyngeal tissues and produce symptoms of the Hal-Zun syndrome. So take note ha, Hal-Zun syndrome, it's also seen in pentastomids. But aside from that, di ba, we mentioned Hal-Zun syndrome in fasciola hepatica na infection. So fascioliasis and pentastomids, Hal-Zun syndrome. So mo-attach sila sa imuhang throat, okay? And the symptoms may include throat discomfort, coughing, sneezing, and dysphagia, maglisod kag swallow, and vomiting. Now, occasionally, pentastomid larva can also infect the eyes if direct contact imuhang eyes with water that contains the pentastomid eggs. Diagnosis is made by identifying the pentastomid in biopsy specimens, and treatment is usually not necessary. However, surgery is still recommended. Samot na if patient is symptomatic. So you need to remove the tongue worm. Okay. So again, it's in the middle, no, of the arthropod and the worm. So you cannot distinguish it as a nematode ba, roundworm. Di po siya totally insect, pero it's in the middle. Ayan, pentastomids. Again, quite rare lang din sa humans, and usually we get it from ingestion of food, water, but it contains the eggs of your pentastomids, okay, or direct contact food with water containing the eggs of pentastomids. So here's an example of Linguatula serrata. As you can see, it's called tongueworm kaya di ba mura siyang tongue, iyang appearance. Ayan, Linguatula serrata. Next, you have Armilifer. As you can see, naka-attach siya sa diaphragm. So, mu-burrow siya or mutapot siya dito. And here's an example of Armilifer po. Di ba? So, you can see, mura siya, lahigid siya na appearance, no? Pwede siyang insect, pwede po siyang pwede po siyang worm, no? So, worm-like, no? Worm-like ng mga arthropods. Ayan, that's pentastomids. Your tongue worms. Because again, iyang appearance mura siya dila, mura siya tongue. Okay. Now, for summary na lang of the arthropods that cause infection, this is from Zybig. As you can see, ang ticks good usually, ang makos sa mga ticks is both parasitic and bacterial. But majority, ang dala nila kay mga bacteria. No? Yung anaplasma, you have Bartonella, mga rickettsia organisms. Okay. Next, you have mites. Of course, pwedeng mga mga viral pathogens yung dala. Or of course, scabies. You have spiders, scorpions, fleas, of course, intermediate host, flies, of course, pwede siyang parasite pod or pwede pong mechanical vector. Lice, of course, you have kuto. Mosquitoes, again, are biological vectors of a lot of parasites and pathogens. And bugs, you have Trypanosoma cruzi, example, kissing bug. No? So, in a bite wound and sanitation issues and all that. So, we have discussed this mga arthropods so far sa different parasites natong na-discuss, di ba? We have discussed this as intermediate host. So, ato nang gi-focus kay kato mga uban karon. All right? Okay. Now, for summary, ayan, as you can see, daghan-daghan kayo dears, no? So, medyo ubay-ubay ang chika dira. But again, it's summarized now. Unsay possible effects sa humans of the different insects, no? From mosquitoes to spiders to the mites. Ayan. So, again, different fleas. You have the cockroach and also beetles. Ayan. Now, for the another one is mga arachnida. Usually, ang mga spiders, deers, they are usually more on biting and stings, and usually they produce venom, no? So venom, usually mga spiders, mga bees, no, mga wasps. So more on stinging sila, more on biting. Ayan. And they have venoms in their stings or ilahang mga bites. Okay. All right. Now, again, for diagnosis, as you can see, depende siya. For fly larva, it's best to remove the larva gyud from the ulceration sa skin, myiasis, di ba? And then you submit that to the laboratory for identification of the species. Okay? Now, for bed bugs, it's more on mga topical medicine, no? Like mga creams para mawala ang itching and all that. And of course, sanitation of the bed, tangtangon or fogging or whatever to remove the bed bugs. For fleas, of course, for tunga penetrans, di ba katong mo penetrate sa TL usually, it's best to remove it through forceps, imong tunga penetrans, all right? And if dili nimo siya ma-remove, pwede siyang mo-proceed to ulceration. All right. Okay, and different fleas, still the same, no? Example, if mga pets ninyo, so make sure that your pets are not having fleas. Make sure that they're free sila from fleas. So dapat imo siyang paliguan or para jud wala sila fleas. Okay? All right, ayan. Next, you have lice, of course, sa ato ang head, sa atong pubic, and also sa body. Of course, hygiene, no? Washing. If maligo mo, dapat ang imuhang shampoo kay makapatay sa lice. All right? Ticks, very important for ticks. Again, aside from that, it can cause tick paralysis. So na ibang mga ticks, dears, that pag paak nila nimo, they also produce toxin, no? And the toxin are neurotoxic, no? Pwede siyang makaparalyze and eventually leads to death, no? So it's best good na example usually sa US mo gani common. So if naggikan ka og dula-dula sa mga bushes, no, or nag-trekking manggani ka, and then you have to examine yourself kung nabay mga ticks na naka-attach nimo. And then if naman gani naka-attach, you have to remove that immediately. Okay? Because again, of tick paralysis and other mga pathogens such as Borrelia, Lyme disease, no, Babesia, and all that. So daghan pa yung possible. All right? So tick paralysis is due to the toxin produced by the ticks during feeding sa imuha. Okay, all right. It can lead to death if dili siya maagapan. Next for mites, of course, are Coptis KBI, itch mite. Topical application gyapon of mga creams para mawala. And of course, you have to yeah, muna siya yung tambal. All right? Okay. And then spiders, of course, more on stinging, all right, or biting, and their bites contain venom. All right? So venom. So it's best to, if mapaakan ka, best to go to the hospital gyapon para na anti-venom, or butangan nimo ice pack imuhang paak para dili mo spread ang venom. Okay. All right. Ayan. Next, that's the end pala. Okay. All right. And that's the end. Yes. So that's for the arthropods, no? And entirety of parasitology, no? So from the endoparasites to the ectoparasites, ang dami nating na chika. All right. But before we end, any questions, dears? Any clarifications?